Hey everyone, this is Patrick Chancy. Uh, I hate that this is the way that we have to do these things, but we are offering this class, or our usual health and wellness class. We're going to give you an option to be able to take it online and to watch this video with us. We obviously wish we can do, we do have some of our usual classes, but we wanted to give you this option as well for those of you that want to feel comfortable doing it this way. Today we have Garrett Fawcett, a fourth year student from the University of Georgia. And he is working on presenting a presentation that was worked on as well by Riddhi Patel from South University. And today he is going to share with you a topic that we're all talking about right now, but stuff that is important to keep in mind even as we're moving into a reopening phase. So we want to make sure this is still at the forefront of how you're operating. So without further ado, I'm going to hand this over to Garrett.
Hi, everyone. As Patrick said, my name is Garrett Fawcett, and I'm currently a pharmacy student at the University of Georgia College of Pharmacy, and I'm currently interning with Chancy Drugs. My colleague Riddhi Patel and I put together this class today to give you tips on staying healthy during COVID-19. Things definitely look a little different in today's world, and we want to make sure you all receive valuable information that can help keep you and your family safe and healthy. Throughout this class, we're going to be addressing what exactly coronavirus is, how coronavirus is spread, what are the symptoms of coronavirus, what testing is available for coronavirus, who is at risk for complications with coronavirus, and what you can do to protect yourself and your family. There are several names associated with the coronavirus we see in the media today, and it's important to understand how those names relate to the pandemic. Coronavirus is a family of viruses that people and animals can get. Within that family, there are three types which we can get from animals: MERS-CoV, SARS-CoV, SARS-CoV-2, which is the type of the coronavirus that the current pandemic is caused by. The disease itself is called COVID-19, and you can see above how that name was generated with the CO indicating corona, VI indicating virus, D indicating disease, and 19 indicating the year it made its appearance. One way to look at it is if coronavirus was a tree, SARS-CoV-2 would be a branch, and COVID-19 would be a leaf on that branch. Coronavirus is primarily spread via droplets from the mouth or nose. When you cough, sneeze, or even talk, small droplets containing the virus can be released into the air, which can then be inhaled by others. Since COVID-19 is primarily spread from person to person, you can become infected by coming into close contact with a person who has the virus. You may also be able to get it by touching a surface that has the virus on it and then touching your face, eyes, or mouth. So what are the symptoms of coronavirus? The most common symptoms of coronavirus include low-grade fever, wet cough, and shortness of breath. Other reported symptoms are listed here, and it's important to realize too, there are several other possible causes for some of these symptoms. But if you begin to experience some of these symptoms, be sure to reach out to your doctor to determine the best course of action to take. It's also important to understand when you should seek emergency medical attention. Trouble breathing, chest pain or pressure, new confusion, trouble staying awake, or bluish lips or face are a few warning signs that may indicate an appropriate reason to use emergency medical services. There are currently two different types of testing available for COVID-19. Viral testing is a nasal swab of the nose and is what you primarily see in the news to determine if you currently have the virus. A negative viral test would mean you are likely not currently infected, but you could still become infected at a later time. Antibody testing is another test that's currently available, which is a test used to tell you if you've had a past infection of COVID-19. This is a blood test, and a negative test indicates you've likely had no prior exposure to COVID-19, but you could still have a current infection, and this is because it takes approximately 1 to 3 weeks for antibodies to be made by your immune system. As far as testing for COVID-19, not everyone necessarily should be tested to see if they have a current infection. Most people have a mild illness and are able to recover at home without extensive medical care. If you feel you might be sick, it's best to be safe and stay home until you can speak with your doctor. It's important to have yourself screened by a healthcare professional to determine if you should be tested for the virus. The CDC website also includes a self-checker tool to help determine if you might be a good candidate for testing. And we've included a link to that tool at the bottom of this slide. So who are considered high-risk patients? Anyone 65 years old or older, people living in nursing homes or long-term care facilities, and people with certain health conditions listed here are considered high risk. Many of these conditions, such as heart disease and diabetes, are pretty common among the population. Immunocompromised individuals include those who have received a bone marrow or organ transplant, have certain immune deficiencies, and those who have prolonged use of steroids and other immune weakening medications. Though patients who have diabetes are considered high risk for developing severe complications due to COVID-19, your risk is significantly less if your diabetes is managed properly. Managing your diabetes properly can be done by taking your medications regularly, checking your blood sugar as recommended by your doctor, and by eating healthily and exercising regularly. The American Diabetes Association, or ADA, does not expect manufacturers to have difficulty supplying the market with insulin or other diabetes medications. They also have information to provide if you're struggling affording your insulin due to the loss of a job or income during the pandemic. You can find this information here at insulinhelp.org. Now that we know more information about the virus itself and who are at increased risk of having complications from the virus, we want to focus on what you can do to protect yourself and your family. One of the easiest things you can do to make sure you protect yourself is to take your medication as prescribed regularly. This is important to make sure you are adequately controlling chronic conditions such as heart disease or diabetes, as well as treating temporary conditions like a brief illness. If you feel you sometimes forget to take your medications, there are many ways which may help you remember. Setting your reminders or alarms in your phone may help, as well as using a pill organizer, as we've got in this top right corner of this slide. Here at Chancy Drugs, we also offer pill packaging to our patients and help them manage their medications. Be sure to ask any of our staff about pill packaging or managing your medications. Healthy eating is another incredibly important method of protecting yourself and promoting your overall health. Here you can see an image many use to help visualize what a typical healthy meal should look like. Overall, your plate should consist of a variety of vegetables other than starches like potatoes. Low-fat protein options such as fish and chicken are also important to a healthy diet. Beans and nuts are also healthy non-meat protein sources. A variety of whole grains are important to healthy diets as well, and it's best to limit refined grains like white rice and white bread. Last but not least, a healthy diet should include plenty of fruits of all colors. Staying hydrated by drinking plenty of water is also important. It's best to avoid sugary drinks like sodas or juices whenever possible to reduce the amount of excess sugar you consume. Sometimes the hardest issue many people deal with is deciding what they want to eat after a long day of work, which often results in quicker, unhealthy meals. Planning out your weekly meals using a calendar is a great way to make sure each meal contains all of the pieces to a healthy diet to make sure you're well protected. Grocery shopping has definitely been affected by recent events. If you're not able to visit grocery stores, there are now services which do your shopping for you. Many of the main stores even offer their own delivery services for customers who are unable to shop themselves. When grocery shopping, it's also important to resist the urge to buy groceries in large quantities. Preparing a list to cover your family for 2 weeks is often sufficient to make sure your meals are covered. There are also food delivery services such as DoorDash, Uber Eats, and Grubhub for restaurants which can deliver hot meals to many locations. Exercise is also important to consider if your daily activities are limited. Here are a few examples of healthy exercise options you or your family might be able to consider. Though some of these may be difficult to incorporate into your weekly schedule, interval walking is safe and easy to do at home. Start by walking your normal pace for 3 to 4 minutes and then increase your speed for 1 minute and repeat. This change in speed increases your heart rate to allow for some aerobic activity while allowing time to recover during your normal pace. Aerobic activities such as walking or jogging and strength training activities are some of the most common exercises many can do while at home. Here you can see additional specific recommendations to exercise at home. If you're exercising outside, it's important to maintain safe social distances while exercising to protect yourself and others. There are also many workout apps available to download which help coach you through various workouts. We've included various online sites which also offer workout routines and a graphic highlighting the 5, 4, 3, 2, and 1 workout. This workout strives to give you the opportunity to exercise in 15 minutes to help promote healthy living during a busy week. One of the most overlooked areas of your health is your sleep. For adults, it's recommended to get at least 7 to 9 hours of sleep. A good night's rest empowers the immune system, heightens brain function, enhances mood, and improves your overall mental health. Things you can do to improve your quality of sleep include setting a schedule and routine to wake up and go to sleep about the same time every day. This helps your body get into a routine while improving your sleep quality. People who avoid working in their bedroom also tend to sleep better. Exposing yourself to sunlight in the morning and avoiding bright light late in the evening also helps your body manage its sleep schedule. Vaccinations are also key to promote healthy living. Though there is currently no vaccine offered to directly protect yourself from COVID-19, there are other vaccines available to protect you from respiratory illnesses. Flu shots are offered yearly and can prevent further health complications. Pneumonia vaccines are also incredibly important to prevent hospitalizations. There are 2 pneumonia vaccines currently available, and anyone 65 years or older is recommended to receive Pneumovax, whereas younger patients who may have certain conditions which increase the risk for pneumonia are able to receive Prevnar 13 and Pneumovax. We're expecting both flu shots and pneumonia vaccines to be in high demand this season, so be sure to talk with your pharmacist soon to make sure you're well protected. Cleaning your hands often is another way to protect yourself. Here you can see a picture of various pieces of bread which were touched by dirty and clean hands. You can see the impact washing your hands appropriately can make. Soap and water is the preferred way to clean your hands, and you should wash for at least 20 seconds. Hand sanitizer is also a great way to clean your hands, but it must have at least 60% alcohol. There are certain times when soap and water should be used, and certain times when an alcohol-based hand sanitizer may be used. Hand sanitizer can be used when soap and water is not available, but it's important not to use hand sanitizer if your hands are visibly dirty or greasy. As you've probably seen, social distancing is incredibly important when protecting yourself and those around you. Current recommendations still support avoiding crowds if possible. Stay at home as much as possible and avoid touching your face, nose, and eyes. It's also best to avoid touching high contact surfaces such as elevator buttons, door handles, and handrails, as well as avoiding handshaking when possible. To protect others, we can all do our part to stay home, especially if we're sick, cover our coughs or sneezes, wear face coverings when out, and clean or disinfect surfaces others may touch frequently, like switches, doorknobs, and phones. The CDC does recommend using face coverings whenever possible. Face coverings should not be used on anyone under 2 years old or with those who may have trouble breathing or are unable to remove the mask without assistance. We've also included a link here which has instructions on making your own face mask if you don't have one. Now we're going to give you the opportunity to show what you know. For those of you watching to complete your quarterly requirement, be sure to listen closely and remember this question. Is hand washing or hand sanitizer recommended most? Hand washing with soap and water is always recommended over hand sanitizer. Hand sanitizer with 60% alcohol is perfectly fine to use if you don't have access to soap or water. So in summary, to stay healthy, it's important to manage your chronic conditions by taking your medications regularly, eating a well-balanced diet, exercising regularly, and getting a good night's rest. Get your flu shot each flu season to make sure you're protected, and speak with your pharmacist soon to see if you're eligible for a pneumonia vaccine. Clean your hands often with soap and water or hand sanitizer with at least 60% alcohol if you're unable to wash your hands. Avoid close contact with others and take steps to protect those around you. This can include limiting unnecessary travel, covering coughs and sneezes, wearing face coverings in public places, and cleaning or disinfecting surfaces often. Here's a quick graphic provided by the CDC highlighting some of the safety steps we've discussed today to stay healthy. Stay home if you don't feel well or if you've recently tested positive or been exposed to someone with COVID-19. Stay at least 6 feet away from others who don't live with you. Wear cloth face coverings when out in public areas. Wash your hands often with soap and water for at least 20 seconds or use hand sanitizer. And cover your coughs and sneezes with a tissue or with your elbow. We've also included some trustworthy resources to find out more information regarding healthy living. Much of this information is recommended by healthcare professionals to promote healthy lifestyles and to protect yourself and others. Here are some of the references from the information presented during this class. And thank you all again for listening in, and keep up the good work with managing your health while protecting yourself and others. Stay safe and let us know if you need anything or if you have any questions.